Good afternoon, everybody. Good afternoon, and thank you to tuning in to our regular Wednesday at 1 o'clock press conference. For even more frequent updates than once a week, I'd encourage you to go to governor.ri.gov, sign up for the daily email. I think we have over 100,000 Rhode Islanders who've done that. It's an excellent way to get information. Every day we'll send you an email. I want to make a note about this press conference due to the fact that the election is next Tuesday. We're going to push this press conference from next Wednesday to next Thursday at 1 o'clock, and the same thing for the following week because of Veterans Day. So for the next 2 weeks, next week and the week after, it'll be Thursday at 1 o'clock instead of Wednesday at 1 o'clock. Okay, today we'll begin as we always do with the data, and it's not a good news story. And I'd ask you please to put the dashboard on the screen. So as you can see from the dashboard in front of you, we are continuing to trend in the wrong direction. Every week for the past few weeks, I have said that we're not in a good place. I'll say today we're in a bad place. This data is not encouraging. It's headed in the wrong direction in every metric, and it's a wake-up call, more than a wake-up call, really, for every single one of us to ask ourselves, what am I going to do differently? And that's what I would ask you. It's what I ask myself. It's what I ask my team. We're headed in the wrong direction. It's within our control to change the trajectory. So I want you to ask yourself and your family, your friends, what are you going to do differently? Because we have to start doing things differently if we're going to change the trend. And I'm going to give you some specific ways you could adjust your behavior to get Rhode Island back on the right track. Yesterday, we had 425 new cases out of about 13,000 tests for a percent positive of 3.2%. And very sadly, yesterday, we are also reporting another 4 deaths. At this point, we've performed just about 1.1 million tests. The million test mark was a huge milestone. We passed it at the end of last week. And in so doing, we became the first state in the country to test the equivalent of our entire population. So to all of you who have had a test, or National Guard who's been participating and administering the test, I want to thank you for that. Testing continues to be one of the most effective tools in our toolbox as we fight the virus, and Rhode Island continues to lead the nation in our testing. You can see the weekly trend data and see the arrows on the right-hand side. All the arrows are pointing up. Last week, our percent positive was 2.9%. That's the highest it's been in over 2 months. You'll notice that arrow is yellow. The reason it's yellow is because it reflects a 100% increase over the past 4 weeks. So the past 4 weeks, it's been a doubling. And by the way, it's continuing to tick up quickly. Last week, we also saw 139 new hospitalizations, including several days with over 20 new hospitalizations. And we have 242 new cases per 100,000. So day to day, over the past few days, we are continuing to see record new numbers of cases. And that's true even if you account for the fact that we are testing in record high numbers. It's too high, too many cases, too many hospitalizations. I say to you today, we all need to adjust our behavior. And I want to say this, the vast majority of you are doing your level best to follow the rules. I see it. I see you. We're inspecting. You're wearing your masks in restaurants. You are trying to stay home if you're sick. If your kids are getting sick in school, you're taking them right away to get tested. The truth of it is, though, all of us have let our guard down because we've been at this for a long time, and we're getting tired, we're getting fatigued, we're missing our friends and our family, and it is clearly being reflected in our data. And the increase, now that we've poured through thousands of case investigations, it's very clear where the increase is coming from. It's coming from casual gatherings with family and friends in settings where our guards are down, we're relaxed, we get close to people, and our masks are off. And the truth of the matter is, we're all starting to spend time with too many people. For a long time, I say, keep your social network small, and we were doing that. And now, through nobody's fault, through natural course of being a human being, we're all extending our networks and seeing more people who we know. And naturally, when you're with people you know, you let your guard down, you take your mask off, and as a result, we're not in a great place. So I want to ask you, everyone who's watching now or listening, I'd ask you to take out a piece of paper and write down the names of the few people that you're going to see for the next couple of weeks. Write down, who do you really need to be with in the next couple of weeks? People you live with, your family, few coworkers. That's it. That's it. We have to keep our groups small and stable because we need to turn around this trend. We have got to stop the trend and turn the corner. So I'm asking you now, for the next couple of weeks, limit your interactions to the people that you need to see. You need to see the people you live with. You need to see the kids who sit around you in your class. You need to see your few coworkers. Write those names down and try very hard to stay within that closed circle. So what are some of the things that means we're not going to be doing? You don't need to go watch a sports game or a sports practice. You don't need to go out for coffee after church or go over somebody's house for brunch after church. You don't need to have friends over for dinner or lunch. You don't need to go out and have, hang out with your coworkers after work. You don't need to have 3 play dates in a weekend. These are the things that we just don't have the luxury to be doing now in the next couple of weeks. And if you find yourself in a setting, any setting, at the park, in your living room, at the office, with people you don't live with, please put your mask on. Please put your mask on. Mask wearing is one of the simplest things we can do with the biggest impact. It's become political. That's unfortunate. I'm just going to tell you the facts right now. Not my opinion, just the facts. In a new study from the University of Washington, it had showed that if 95% of Americans wore masks around other people, and we didn't change anything else, didn't close businesses, didn't reduce any of the social gatherings, we would save 100,000 lives in the next 4 months. So this is what I'm asking you to do. Dr. Alexander Scott talks frequently. She loves to, and she's great at it, talk about the 3 W's: wear your mask, wash your hands, and watch your distance. Today, I want to add for you to think about the 3 I's, which is situations to avoid: informal, indoors, and inconsistent groups, because that's where the spread is happening. Unstructured events outside of your home in casual environments where folks take their mask off. As I said, we're in a bad place. We're not in a good place. We need to turn the corner. And so I'm struggling to find ways to encourage folks and communicate, given the fact that we're all sick and tired of doing this. And most of you may be hearing me saying, yeah, Gov, I'm already doing it. We're doing this. I wear a mask wherever I go. So I'm giving you really specific things to do. Make that list of people you must be with over the next couple of weeks and limit your interaction to being with those people. And all of the nice to haves, hanging out with friends after work, going out for drinks or dinner with a big group, lots of play dates, I'm asking you not to do it. And if you are with folks who you don't live with, put your mask on, even if it feels strange, even if it feels like you wish you didn't have to do it. It works, it will save lives, and it'll prevent us from having to close down our economy again. Speaking of that, we're nearing our own metrics to move back to phase 2. On the trajectory we are on, that could happen in a week or two. The projections for our hospitalizations are alarming. And we know that hospitalizations tend to follow the case trends in a couple of weeks. Hospitalizations, we know, lag the case trends. So cases are through the roof now. 2-3 weeks from now, we'll have a real problem with our hospitalizations. Based on our current projections, it's possible we could surpass the surge capacity in our hospitals in 4 to 5 weeks, and then we would have to start using our field hospitals. And by the way, that's what's happening. Unfortunately, Rhode Island's not alone. Look all over the world, look all over the country. This is what you're seeing. We're on the same trajectory that many states in the Midwest saw a month ago, and now they all have their field hospitals open. North Dakota is at its ICU capacity. Utah is planning to ration care. Texas is building new field hospitals. We're not there yet. I'm putting my faith in the people of Rhode Island that we'll never get there. It's within our power now to change our behavior in small, daily, but important ways to make it so that we never get there. But I'm going to be honest with you and just tell you the facts that if we don't all commit to making some changes, we're going to have to open the field hospital in a few weeks. I'm going to have to go back to phase 2 in a couple of weeks, and maybe even more. We'll all be asked again to put our lives and our businesses on hold. Unless we now change our behavior. Wear your mask, stop seeing friends, and everything else that I have said. I will say this, I'm going to hold a special press conference on Friday at 1 o'clock because I'm going to be making some more announcements about restrictions. I am not convinced that going back to phase 2 is necessarily the right thing. I am convinced that we need some more restrictions. So I'm not ready today to say exactly what the restrictions are. I'm not necessarily saying it'll be automatically phase 2 because it's different now. Obviously, November is very different than March, but I do believe it's getting to be time to reimpose some restrictions because we have to keep a lid on this now while we still can. And while we still have a chance to stop the spread, and it is a fact that our actions in the coming days will matter. So you members of the press will undoubtedly ask me, what am I going to do on Friday? The answer is tune in Friday at 1, but I'm looking at everything. More restrictions on workplaces, reducing the social gathering limit from 15 to a lower number, everything's on the table as we try to evaluate the best, most targeted things we can do to keep Rhode Island to get Rhode Island in a better place. We're able now to target our interventions better because of all our testing, because of all our data. So I'd like to not have a blunt instrument of phase 2, but we're going to have to put some more restrictions in, and I would invite you to join me at 1 o'clock on Friday to talk about that. My executive order for phase 3 is up today. I will sign that to renew it, but I'm very likely to change it on Friday. Okay, speaking of places where we, specific environments, I do want to talk for a minute about schools. I suppose the good news in all of this is that we are not seeing significant spread in schools, or for that matter, in controlled environments. Cases are rising all over the country. I'm sure you've seen in the news that cities like Boston have switched to remote learning. And it is true that we're in a tricky spot. And we're all trying to figure out the right levers to pull in order to turn our trend around. And an impulse may be to just flip to distance learning. But I don't believe that's the right thing to do, even though it may sound easy to do. And let me tell you why. I'm going to be very clear about what's going on and how I'm making these decisions. And as always, it's based on the facts and the data and what's going on in the science and what we're seeing. And now we have been in school for 7 weeks, so we have pretty good data, enough data, and actual 7 weeks of experience that I'd like to share with you. Across Rhode Island, we have about 98,500 students doing in-person learning, some form of in-person learning, and 49,700 students learning virtually. So about 100,000 kids in school, about 50,000 kids purely virtual. Last week, when we saw record numbers of cases in Rhode Island, the case prevalence rate in both groups of the kids was about 0.13%. In other words, extremely low. Since schools opened on September 14th, we've seen 363 cases among the in-school students and 312 among the virtual students. So obviously the prevalence, the rate, you can see there, it's 363 among the 100,000, 312 among the 50,000. This tells us a couple things. Number one, schools are not super spreaders. Number two, the kids in distance learning aren't staying home. It's not at all clear that it's quote unquote safer for kids to learn from home. If they're in high school, they might be going to work, they go to their job, they're hanging out with friends, they are participating in sports, they're out and about. Their parents work, their parents are coming home to see them. They're getting together with their friends to do study groups. They're congregating a lot due to sports. How do I know that? Because we've done a lot of case investigations and we talk to them and they tell us, this is where I've been. I went to work at such and such a place. I then went to play sports. I did this. So, and by the way, this isn't unique to Rhode Island. So the fact is, to say, let's just go virtual, there's really no data to suggest that that's quote unquote safer for teachers and students because they're getting the virus in similar, if not higher rates than the kids in school. But what we do know is the kids at home are more likely to be susceptible to abuse and neglect, falling behind in school, struggling with distance learning, emotional and mental health issues. And so it's for those reasons that I have been so strong in my desire, as long as the data shows it's safe and as long as we can keep our systems going, to keep the children in school. And I just would like to share, again, this isn't just Rhode Island. What we are seeing in Rhode Island over these past 7 weeks is incredibly consistent with what's been seen in schools around the country and around the world. A recent study of 191 countries found no correlation between school status and infections, which is exactly what we are seeing. In fact, the report recommended that what we are doing, requiring masks in schools, developing schedules, keeping kids in pods, stable groups, closing schools on a case-by-case basis, is the right way to go. I think it was a week ago, one of you asked me about a study from a Brown professor, Emily Oster, talking about school reopenings. And she surveyed 200,000 students in schools in 47 states. And interestingly, she found an infection rate of 0.13%, exactly the same number we're seeing here in Rhode Island, and extremely low. And her study found that kids are generally not getting infected and spreading to generally not getting infected and spreading it to family members and others in the community. And the same conclusion was reached in a study of schools in Spain, which found that 87% of school cases were single cases and not transmitted to others. So why am I sharing all of this with you? Because a few reasons. One, people are anxious. Parents are worried. Should I keep sending my children to school? School districts are wondering, should we just go ahead and do virtual in light of this increase in cases? But also because I want you to know everything I'm doing is a constant reevaluation of, are we doing the right thing based on what we know? It's not set in stone. It's what's going on in the data. What are we learning? What are we seeing? Are people safe? And what I can tell you now is everything I've just said, which is I understand the impulse to say, go virtual. But if you look at all the facts and the data, there is no reason to believe that that will result in a lower rate of infection in our school kids. And there's every reason to believe that it will harm our children's development. So we will continue to look at it and evaluate it, but I just thought that I would share that with you. Now, one area that's critical to keeping kids in school and limiting the spread of the virus is effective systems, effective testing, effective cleaning, and effective contact tracing. And there've been a lot of questions lately about the contact tracing. And the truth of the matter is our contact tracing systems are overwhelmed at the moment and being pushed to the limits. And so to those of you who have had to wait too long, we apologize. And I'm going to tell you now about some actions that we're taking to make it better. As of today, we have 300 total contact tracers. That's 300 individuals whose full-time job it is to do contact tracing when somebody's positive. 80 of the 300 are dedicated exclusively to K through 12. That's a significant increase from where we were a month ago. Since the end of September, we've added about 100 contact tracers, but here's a key thing. We've added 50 in the last week alone. So I don't want you to think we are standing still. The volume is going up. We know we need to do better. The system is strained, and it's going to get better. Just in the past week, we've added 50 more people, and we're evaluating every aspect of how we do it. Better leveraging technology, changing the form of the interview so it's shorter and easier to engage with, adding even more people. I promise you we're doing everything we know how to do, and we're going to continue to work as hard as we know how to work. I need your help, though. A few weeks ago, I got up here and said, we need substitute teachers, and I put a call out. Within days, we had 1,000 amazing Rhode Islanders raise their hand and said, I'm in to help, Governor. So I'm coming back to you now with a request. Right now, we are currently looking to hire 100 case investigators at the Department of Health. So if you have any customer service experience and you're able to work full-time, including some nights and weekends, for at least the next 6 months, I'm asking you please today to go visit health.ri.gov/COVID jobs. And hopefully that's on your screen. health.ri.gov/COVID jobs. We'll pay competitively. If you have any inclination to want to do this kind of work, maybe you're looking for a job, maybe you just want to help out the cause, we need you. We need you now. We need your help. We will train you. It's an interesting job, and you'll be helping the cause. And as I said, we're looking to hire 100 case investigators as quickly as we can to work at the Department of Health. So this is what we're doing: streamlining, tech enabling, hiring, and working our tail off and committing to you to a better level of service. But I also need the help of the students, parents, and teachers. The reality is, a big part of this, some of the reason that we're getting behind is because the volume is up. More kids are being tested, we have to do more contact tracing. But that's actually not the real reason. The real reason is because people have too many contacts. So, and that should not be that way right now. If everyone's doing what they're supposed to do, when we call you and ask you for the number of people you've been in close contact with, it should be a pretty short list. It should be a handful of people. And if it is a handful of people, we do our work quickly and we move on, there's no backlog. But the truth of it is, we are calling people and they're telling us they have 50 close contacts. No one should have 50 close contacts right now, please. And if you do, if you're hearing me say that and say, oh, maybe I do, please just take occasion now to go get that list and write down the folks you're going to be with in the next couple of weeks and make sure it's far less than 50. It's the people you live with, couple friends, people you work with. The more close contacts you have, the more likely you are to spread the virus. It also means the contact tracing job that should take a couple of hours is taking us a day or more to get through, and so we're getting behind. It bogs down the whole system. And again, it's close contacts. Obviously, a teacher might be with 100 students throughout a day in a high school. Those aren't close contacts. We might be, I'm here now with however many people. These aren't close contacts. A close contact is someone who you're close to, closer than 6 feet for more than 15 minutes. This, by the way, would be a good time to go ahead and break out your contact tracing journal. We used to have them and use them diligently. Probably for most of us, it's been collecting dust. Go ahead and break out the contact tracing journal. Dust it off and let's get back to using it. There's something powerful I have found for myself, forcing yourself every day to write down the list of people you were with and confronting how long that list is. If you don't feel like doing that, download the Crush COVID app and use that app. But it's something that I'm asking everyone to do. By the way, it'll help us do contact tracing faster. So if you're a teacher or a parent or a principal who's been frustrated by how slow contact tracing is, help us out by encouraging everyone to have a contact tracing journal, use the Crush COVID app, and keep their social networks as small as possible. Also, the other thing I would ask principals, superintendents, and others to help us out with is seating charts. The power of an accurate seating chart is amazing. It's tough for the contact tracers to do their job if they get a seating chart on a napkin, if they get the wrong seating chart for a particular bus, if the seating chart's not accurate. So again, I'm not just saying do better, work harder, because I know you're all doing great and working hard. One concrete thing, please, every teacher, every bus monitor, every principal, every superintendent, seating a accurate seating chart is worth its weight in gold for us to do contact tracing quickly. So if you could please make sure they are up to date, it would be enormously, enormously helpful. Our contact tracing system is only as good as the information we get. You know, so give us good data quickly and we will turn it around quickly. And then I would say a personal request, which is just please be kind. I know tension is high, everyone is afraid, anxiety is through the roof, and life's tough on everyone right now. That being said, that does not give us a right to be mean. The level of aggression that our contact tracers are receiving in the past couple of weeks from folks, just because they're trying to do their job, is not okay. It's not okay. You know, these are human beings. These are just moms and dads and Rhode Islanders trying to do their job, working 7 days a week. And if they call you to ask you who your close contacts are, or if they call you and tell you, please, you have to be in quarantine, I would ask you to just be kind and courteous and polite. The person we have in charge of contact tracing is a wonderful woman named Christine Campagna. Christine's a mother of 3. She's just had her first grandchild who she never really gets to see because she works 7 days a week until 11 o'clock at night running our contact tracing team. And when I hear the hateful messages that people leave for her or spew at her, screaming, swearing, hanging up the phone, just because she's asking them to who they were in contact with, it's very upsetting. It's not the Rhode Island way, and I know we're better than that. So this is tough. This is tough stuff, and I hear that. But our ability to deliver for you, the people of Rhode Island, depends on everyone's willingness to engage, stay calm, be kind, and follow the rules. And that the simplest thing, if we ask you to quarantine, you ought to quarantine. Don't scream and yell obscenities and hang up the phone, please. And just know that we're doing everything that we can, and these folks are working as hard as they can. 2 other quick notices. Shifting gears, I want to talk about working from home. I've been getting a lot of inbound from business leaders who see the rising cases here and in other states where they do business. They're asking Governor what we can do. Congregating and social gathering outside of work. Enable folks to go get tested, particularly if you're like a manufacturer or a restaurant or a bar. Early to go ahead and get tested. And then anyone who can work productively from home, please let them work productively from home, especially now that we're in this critical time. Those are the asks I have for employers. In addition to what you're already doing a great job of, mask wearing, temperature checking, and general rule following. Finally, as we approach Halloween, I just want to again remind you there should be no Halloween parties this weekend of any size. This isn't the year to do it. Don't have folks over to your house for Halloween. Don't go out to bars. We're going to be out with our enforcement teams. We'll be imposing fines if we see social gatherings, if we see non-mask wearing out at restaurants and bars. I hope we don't have to do that. If we do, in certain cases, if we see crowding at bars and restaurants, we'll go ahead and shut you down immediately, or as I say, impose fines. So it's a big weekend, and this is not the year for Halloween parties, and I'm asking you to be mindful of that. Tomorrow at 3:15, I'll be joined on a Facebook Live by the co-chairs of our Young Adult Task Force to talk about their recommendations for a safe Halloween, as well as their general guidance on how young people can lead the charge to turn the current case trend around. I will say I had the opportunity to spend some time with these young people on a Zoom call last Friday. They're terrific. If you're feeling down about what's going on in the world, spend some time with some young adults because they're inspirational and they're can-do people. And this task force has come up with amazing, wonderful ideas for how we can stem the spread of COVID among college-age students. And they're leading, their peers leading. I want to thank them and encourage you to tune in tomorrow at 3:15. Thank you.
Thank you, Governor. Good afternoon, everyone. Thank you for being with us again today. As the governor shared, we are continuing to see very disturbing trends in our data, particularly when it comes to new cases. Today is the 4th day in a week that we have had more than 400 new cases. And on one of those days, we had a percent positivity higher than 4%. What's important to know is that it is not too late. We can still change course. Really heed the steps that we're saying. We need to take the steps the governor described, and we need to take them now. I want to reiterate them so that they are clear. Your number one message is to wear your mask whenever you're with someone that you don't live with, even if that's with extended family, with teammates, your faith community, your close friends, whether you're indoors in your own home or indoors someplace else, or if you're outdoors. You need to wear your mask if you're with someone you don't live with, and you need to watch your distance. Also, as the governor said, limit social contact with anyone that's outside of your household. Keep your group small and consistent. Don't go shopping and have meals and get coffee or engage in other social activities with those outside of your small, stable group. And when you're with people in that small, stable group, continue to wear a mask and watch your distance. Stick to just the essential activities right now. This is where we need everyone's attention. Wearing your mask once you're with someone you're not with, and limiting to just essential activities, and continuing to take it outside, going to work, go to school, exercise, go to medical appointments, buy the goods you need, eat the meals, take it outdoors, and then return home. Keep your group stable, and no matter what you're doing, wear your mask. Make it as normal as brushing your teeth. You have to have your mask on if you're engaging with anyone that's outside of your household. There's no COVID-19 vaccine right now. The only way to stop the spread is by being accountable, being responsible, and acting to keep those around you safe. And we're giving you the tools to do that. This mask makes all the difference in the world. If we do these things, we won't have days like today where we're announcing 425 new cases. In addition to those cases, we have 136 people currently hospitalized. 18 people are in an intensive care unit, and 8 people are on a ventilator. We sadly have 4 new COVID-19 associated fatalities to report today. 1 person was in their 70s, 1 person was in their 80s, and 2 people were in their 90s. Our prayers are with the families of these Rhode Islanders. What more important way to honor them? By paying attention, doing things differently, wearing that mask and watching your distance when you're with anyone outside of your household. As the governor shared, because these numbers have increased, because people have not been able to do that, but we know that you can, the system has been stretched. We're doing everything we will do to make sure that we adjust to that. We need you to do your part. We need that patience and kindness, understanding when the phone calls are made to us, wearing your mask, and then just knowing if you have symptoms, you need to stay home, members of your household need to stay home, and you can tell the close context around you that that has occurred. While you're waiting to hear from us, you are empowered with the information of what you need to do. Whether you need to get the test scheduled or not, you are empowered with the information. If you have symptoms, particularly a new cough, shortness of breath, or loss of taste or smell, those are the indicators most commonly associated with COVID. That's when you need to stay home, have people in your household stay home, regardless of the time to get the test. That action does not change, and we'll continue to do our part. I'm going to take a minute to let you know what we're seeing in terms of our case investigations data. Between October 13th and 19th, we identified 1,708 new cases. While people between 19 and 24 years of age are still overrepresented in our case data, the case numbers are more evenly distributed among our different age brackets this week. It's still the 19 to 24-year-olds, it's the 30 to 39-year-olds, 40 to 49-year-olds as well. There's a general increasing trend we're seeing among people of all ages and in all communities, really driven by that same notion. Wearing your mask when you're in those comfortable, more casual, informal, unstructured settings. We can make that change, heed the data and the studies that show us that difference. We can stop this. Another trend we're seeing relates to work settings. Roughly 40% of our cases during the time period of the week that I mentioned, October 13th and 19th, were associated with work settings. 75 cases were associated with manufacturing, 64 with retail, and 58 with food services. We've also seen increases in office settings, such as financial settings and services. Our cases related to office settings almost doubled in a week, going from 48 cases to 88 cases. As the governor said, if you are in a decision-making capacity in a business, consider having people work remotely. Even in those work settings, the main concern or the main source of transmission is when people are in scenarios where they're socializing, their guards are down, and their masks are off. It's not the setting itself where there's structure and people are wearing their mask. We don't see cases transmitted to the same extent. So if people are going to work, masking is a must. The final point I'll finish with is to touch on the drug overdose crisis. Sadly, the drug overdose crisis is worse now than it has ever been. This is true in Rhode Island, and it's true in many other places across the country. Rhode Island's overdose numbers peaked in 2016 and then steadily declined over the next few years. Earlier in 2020, we started seeing increases. We're now on a path to exceed our 2016 total by more than 25%. In July, we had more overdose deaths than in any single month since we started tracking the overdose crisis. These are precious lives. The stressors and isolation of the COVID-19 pandemic have certainly contributed to these numbers. But we also started seeing increases in the first 3 months of the year before COVID-19 significantly changed the way that we live. Other factors that are probably contributing to the increase are polysubstance use, using more than one type of drug, and the presence of fentanyl in drugs like cocaine, counterfeit pills, methamphetamine, and other substances. Counterfeit pills, which often look like prescription medications, are in greater supply throughout the country, unfortunately. Just one of these pills, just one, can cause a fatal overdose. We want everyone to know that there is help and there is hope for everyone who is living with the disease of substance use disorder. BH Link is open and available. This is Rhode Island's 24/7 behavioral health hotline. If you call 401-414-LINK, 401-414-5465, you will get connected to trained professionals who can provide confidential counseling, referrals to treatment, and support services. People can also go to BH Link's drop-in center to get connected to support. It's located at 975 Waterman Avenue in East Providence. Additionally, fire stations in Providence, Newport, and Woonsocket are safe stations. They are open every day to help people in crisis get connected to a peer recovery support specialist and treatment and recovery support services. We want every door to treatment and support and recovery to be open to you. For everyone else, if you think someone is overdosing, call 911 immediately. The Rhode Island Good Samaritan law protects people legally who call for help. Also, carry the overdose reversal medicine, naloxone, also called Narcan, and know how to use it. Naloxone is available at pharmacies without a prescription, and it's easy to use as a nasal allergy spray as well. In the same way that we have the power to stop the spread of COVID-19, we can also prevent overdose deaths. These are two preventable health issues. With that, I'll open it up for questions.
Governor, good afternoon. How are you?
Hi.
So you talk a lot about testing every week, and we've heard how the state's ramping up asymptomatic testing. Should anybody in Rhode Island be paying for a test right now?
Well, no, but asymptomatic, if you're not sick, insurance won't cover it. So if you come to the state-run portal, we will not charge you. But I know some people are going to other places, and unfortunately, some of these private labs and such are charging.
So that's the issue, is that somebody went to a private lab, they got charged $160.
Yeah.
They're in a situation, and we hear from the podium,
Yeah.
get tested, get tested, get tested. Sometimes it's not always available from the state, and then they have to shell out $160. You've got millions of dollars that you've talked about allocating for testing. Is there a way for them to get reimbursed on that if they have to go to a lab?
Probably not, but they should just go to the portal.ri.gov, and it'll be free. And we are
It's quick and accessible.
It is pretty quick and accessible, and it's getting better and better. I've heard these stories, and we've called and asked, but they're trying to make a living. I mean, make a buck, if you will, like some of these private companies. So what we're doing now is ramping up more of our free asymptomatic testing. We're going to add more sites. We're going to allow for easier scheduling, like self-scheduling. So I would encourage you to go with the state, get the word out, people, because this is happening. These private guys are charging. But I don't think there's a whole lot I can do about that.
One other thing, can you elaborate a little bit on the numbers for hospitalizations and your projections? Because last year we heard you're worried about the surge. You were kind of at the end of the flu season. And so you had, you put up 3 hospitals, you scale back on 2 now. Can you talk about what you're looking for December, January, February? Because what I hear from a lot of people is people are getting cases, but the concern is the overwhelming that we've seen in North Dakota and all those other places. What does it look like for Rhode Island at the limit overspill? Can you give us some hard numbers on
excellent
that?
question. Because that's exactly right. What I worry about is overflowing hospitals. So a few statistics on the dashboard that folks see. You know, we doubled our hospitalizations in the past 3 weeks. That's not where you want to be. If you're doubling hospitalizations every 21 days or so, if you were to fast forward that, then we'll be out of space in our existing hospitals in a few weeks, like 4 weeks.
Specifically coming in because of COVID?
Yes, exactly. These are people coming in because of COVID. And yes, that's the right answer. So, but bear with me because I'll tell you. So we currently have 136 people in the hospital for COVID, which is just under half of the 300 beds we designated for COVID. If our hospitals go into their maximum surge plans, that stretches capacity to, call it 600 beds at the max. That's existing hospitals surged. We'll be at that in, call it 4 weeks, which is when I'm going to have to open the Cranston facility, which has, I think, 325-ish, 325 COVID beds in Cranston. So that's exactly where we are.
From the equipment that you took down on the other two, do you have that available to ramp up if you need to?
Yes.
Those other two sites?
Yes.
Governor, on the schools.
But I don't want to get there. So yes, I'm prepared for the worst. But if we all make some changes now, we won't get there. Because as I said, that's 4 weeks away. Excuse me. It'd be 4 weeks away before we would be at our max 600 beds and have to tap into Cranston.
Governor, on the schools, as always, there's pushback on what you're saying in terms of spread. The latest numbers show that I think more than 200 of the overall 550-something cases of kids going to school were in the last week of data. So it's almost a third. Does that concern you at all? People are already pointing to that. There's 6 schools that have had more than 5 cases in the last week. So there's some pushback on the no spread. Schools aren't a problem.
So cases are up. There's no doubt about it. Cases are up even in K-12. But still, and we are tracking it daily on it with the schools, still no evidence of wide scale spread. See my comment?
And if I could follow up, Providence teachers.
And again, sorry, Brian, here's the key point. So what's the solution? To send the kids virtually? COVID is just as prevalent in the virtual children.
Cases in the last week.
Yeah, but it's still, I mean, we talk to the kids because we're asking them, who are your contacts? And they have a long list of contacts. And so they're not staying at home.
Sorry, just on the Providence schools, I know the teachers say they're not being treated the same as other districts. We've seen Cumberland didn't have school yesterday because of a positive case of a teacher.